Let's talk about postmenopausal bleeding. This is more common than many people may presume. It's one of the most common reasons ladies come to see me. They may be 1 year, 2 years, 10 years postmenopausal, and they'll have just a little bit of bleeding, and it will concern them, and they'll come in and talk to me. We usually evaluate postmenopausal bleeding by doing an ultrasound, and this is to measure the lining inside the uterus, which should be very thin when we're in menopause because it's no longer growing and being shed as it did when we were younger women having a menstrual cycle. If this lining of the uterus is thickened, there's a chance that there could be polyps or fibroids or even pre-malignant or malignant tissue in there. The only way to be sure is to take a sample of the tissue and send it to the pathologist, the physician who specializes in analyzing tissue. What we usually end up doing is doing an ultrasound, and if that lining is thickened, we go to the operating room and do a procedure called a hysteroscopy. This is sometimes confused with hysterectomy, which is removing the uterus, which is what ectomy means. Oscopy means looking at it. This involves a long scope about the diameter of a straw with a camera on the end. Water comes out the end of the scope, which distends the walls of the uterus so we can actually see inside completely, which is a big advantage over the old kind of evaluation of the uterine lining by simply using a sharp instrument and scraping blindly. Water comes out the end of the instrument, and we can go directly into the uterus without making any incisions. We can see any abnormal tissue that's inside and remove it completely. Since we're not making any incisions, most women have very little discomfort after the procedure. Most have some light cramping for maybe a few hours and light bleeding, and within a couple days they're back completely to normal. Within a few days we get a report of the tissue, and most of the time it's simply polyps that are growing inside that cause this bleeding. Rarely we find pre-malignant or malignant tissue, and we can usually treat this before it has spread. Fortunately, uterine cancer is one of the most treatable cancers, especially if it's caught early. So any ladies postmenopausally who have bleeding, I encourage them to be evaluated to make sure there's nothing that needs to be treated.